It can be an uncomfortable topic, how to engage in safe sex.
From STDs to unplanned pregnancies, possibly cancer-causing viruses, these days the sexual revolution means finding new ways to fight the unknowns in risky relationships. KIMT News 3's Casey Walsh explains some of the newest methods in a Covering Your Health special report.
I love being around people. I'm an extrovert.
Yeah.
I feed off of other people's energy.
Joey Conkle says whether it's getting together with a friend and having a glass of wine, playing with his cats, or getting together with his boys and hitting the gym, he likes to stay active and have a little fun.
It feels so good. I walk out of there, my endorphins are firing, and I feel great. You want to do more things. I want to be out with other people.
Staying on top of his health is a priority. Just like working out, he made another change more than 2 years ago.
I wanted to be more protected. I wanted to take control of my health.
Joey started PrEP, which stands for pre-exposure prophylaxis, and is prescribed to Truvada. It's when you use a medicine that was designed to treat a disease, in this case Truvada for the human immunodeficiency virus known as HIV, and you use it for protection.
It's an extra safety net to have to protect you. I mean, condoms are not 100% effective. It's a fact.
He says it helps for those who may be single or sexually active and not necessarily monogamous. Research shows more than 1 million people are living in the United States with HIV, and 1 out of 8 people not knowing they're infected.
You instantly have fear in your mind. You instantly feel bad and you're scared that you think I could, after that one time, you could have HIV. I could have contracted HIV and it could change my life forever.
But for him, that's not an issue.
With Truvada, the fear is completely gone.
He says with Truvada, he's completely in control of his negative HIV status, especially with the regular checkups that come along with being prescribed to the medication.
I have to go to the doctor every 3 months and get a full STD scan and HIV test.
He says from talking with other people, he's found there are more than a few doctors hesitant about prescribing it. Any general health provider who is qualified to write a prescription can prescribe PrEP. Most private healthcare insurance programs will cover it. If taken correctly and consistently, doctors say PrEP is between 90 and 99% effective in reducing your risk of HIV. Internal medicine physician Bert Humberg says the medication has been around for about 20 years to help treat HIV, and only has been used in recent years to prevent the virus. But he says he thinks it could take a dent out of new cases of HIV.
Somewhere between, there's about 45,000 new cases of HIV every year.
He says Truvada is just another tool in the toolbox to keep everyone safe. It blocks pathways that HIV uses to set up infection.
Let's say the man is HIV positive and the woman is HIV negative, and they want to have children.
He says Truvada can help safely.
Put the woman on PrEP, she starts taking Truvada, then they have the kid the usual way, and everyone remains healthy.
And Truvada isn't the only medicine out there created to help people remain healthy. The human papillomavirus, or HPV vaccine, became available within the last 10 years. Cerro Gordo County Public Health Disease Prevention Specialist Betty Cronas says HPV is a common virus. Research shows nearly 80 million people, or 1 in 4 people in the United States, are currently infected. There's about 14 million people, including teenagers, who become infected with HPV each year. But for many, it's controversial, and the controversy surrounds how the virus spreads.
Just because it's a cancer that is acquired through sex shouldn't be a barrier to parents vaccinating their children for this disease.
There are around 30 different types of HPV that are sexually transmitted. Doctors say it can cause cancers of the cervix and vagina in women, cancers of the penis in men, as well as cancers of the anus and back of the throat. But Cronas believes the vaccine can help stop the spread. The recommendation by health professionals is to treat a person while they're young, even if that's difficult to do.
It's not that we're giving them permission to be sexually active. It's saying, hey, I think sometime in your life you will meet that right person and you will be sexually active, and I want to protect you. I don't want you to get cancer because of that.
And she says another medical advancement that has helped many people, including young adults, is the morning after pill.
The morning after pill is not designed to be someone's full-fledged birth control. It's about, when used properly, it's about 89% effective.
She says other forms of contraceptives like regular birth control, the implant, or the shot are much more effective when used as directed.
It's designed for when your birth control fails. Maybe you forgot to take a pill, maybe the condom broke. There are different scenarios. That's when the morning after pill becomes another tool in the toolbox.
And while infectious disease physician Sandra Corsara says having these advancements really brings added protection in risky behavior, the only way to really prevent it all, including STIs like chlamydia or gonorrhea, is being celibate. But because that may not be a choice for many, she suggests barrier methods.
Barrier methods, that's the best way to prevent all of these things. And you even prevent some viral infections too, including HIV and hepatitis B transmission. So barrier methods are the consensual methods that are best.
All of the medical professionals I spoke to say as long as you're being proactive, you're one step ahead.
You're the person who is trying to take control of their health.
And Joey says that's exactly what he's trying to do.
Taking that pill pretty much guarantees, as long as you adhere to the daily regimen, that you're going to be protected and that you're going to stay HIV negative. And that's what we're trying to do, is decrease the HIV outbreaks.
Casey Walsh, KIMT News 3.
Thank you, Casey. And despite medical advancements, health professionals still recommend condom use for those who are sexually active. When used correctly, they are more than 90% effective protecting against infections and more than 80% effective protecting against pregnancy.